Are you a patient who has an autoimmune diagnosis like arthritis or even gout, and you're wondering, how do I exercise? How can I move my body in a way that doesn't hurt and doesn't cause further damage to my joints? Well, there are plenty of ways that you can engage in low impact exercise activity where it's actually beneficial despite your diagnosis. So things like walking around your neighborhood, walking on a treadmill, things that don't cause a lot of impact to your joints can be really helpful. The fresh air can help clear your mind and be a time for you to bond with your family or a neighbor or friends, and is also healthy exercise to get your heart rate and your blood flow going. If you are nervous about how far you can go, take it easy. Start by just doing a few minutes at a time and gauging how you feel during that process. If you start walking and you notice that your knees or your feet or your ankles or your hips start hurting, that may be an indication that it's time to slow down and head back. Or it can also be your body starting to wake up after periods of inactivity. Muscle soreness with exercise is not a bad thing, but when you're experiencing pain, deep, sharp shooting pain in a joint or other body area while you're trying to exercise, that may be a signal that you're pushing yourself too far. If you're trying to exercise on a joint that's swollen, let's say an ankle or a knee, that might feel uncomfortable. But again, you can stretch that joint and gradually increase your way up to doing activity. I do encourage that you avoid impact exercises like jumping squats or things where you're lifting heavy weight and bearing on a joint that's inflamed or tender. That can cause increased risk of injury to that joint. If you're a patient with psoriatic arthritis or ankylosing spondylitis, you may notice that you feel much better when you exercise with stretching, things like yoga, or just gentle non-weight bearing activity. And this is an indication too that you may need improvement in your medication to help loosen up that stiffness. As long as that's under 30 minutes, that's our target for medication effectiveness. If you have gout, for example, and bearing weight on a joint is extremely tender, give yourself some grace during those flares and then start to increase your activity once you recover. Impact on a joint that has crystal deposits like gout or pseudogout can actually trigger jolting of those deposits, and patients may notice a flare shortly after exercising. This may also be an indication that your medication is not as effective as it possibly could be for you. So that's a good opportunity to talk with your healthcare provider to discuss if you need more aggressive treatment. I hope these tips are helpful, and we look forward to serving you at Summit Rheumatology.